As COVID cases surge, North Texas hospitals could soon be faced with a shortage of life-saving equipment. So it begs the question for some, whose life is worth saving? Some people with disabilities worry that they may not make the cut. And tonight, I-Team reporter Brian New taking a closer look at a change that was made just today here in Texas that is aimed at giving everyone the same chance at beating COVID.
No one wants to think about it, but Texas hospitals could soon have to decide who gets an ICU bed or a ventilator and who doesn't.
It's very scary. I can't.
Laura Halvorson says she fears if that happens, she would be one who would be denied care simply because the former Mesquite school teacher has muscular dystrophy.
Our lives are not disposable, and we deserve medical treatment just as much as anyone else, even during a pandemic.
Prior to today, disability rights advocates say the North Texas triage guidelines failed to protect the disabled from being discriminated against if resources had to be rationed, which meant if Laura was hospitalized with COVID, she not only could have been sent to the back of the line for treatment, but her ventilator that she uses 24 hours a day could have been taken away.
So the old guidelines did not explicitly say if someone comes in with a ventilator, take it from them, but they didn't prohibit that action.
Lisa Sneed is with Disability Rights Texas, one of several organizations that this summer filed federal civil rights complaints against local emergency triage protocols. Today, the North Texas Crisis Guidelines added protections for the disabled and older adults.
We're in a better position where, unfortunately, if the guidelines do get put into effect, they are less discriminatory, but of course it does mean if the guidelines go into effect, people are going to not receive all of the care that they could.
For Laura, she still worries about getting COVID, but says now if she does, at least she knows she'll be given the same fighting chance to beat it as everyone else. Advocates say they are hoping that the changes made here in North Texas can be used as a model for the entire state. Texas currently does not have any statewide crisis standard. In Plano, Brian New, CBS 11 News.